This video will cover Part 3 of Chapter 6, Health Psychology for PSY 120, Careers in Psychology, Neuroscience, and Human Development. In this part of the chapter, we'll be talking about opportunities for people who have interest in the intersection between health and psychology with a graduate degree. Becoming a health psychologist, much like becoming a forensic psychologist, involves a doctoral degree with a specialization, which is a specialization of clinical psychology. Typically, health psychologists are going to get a clinical psychology degree with a specialization in health. Health psychologists are employed in a lot of different kinds of settings, most typically hospitals, clinics, long-term care facilities, although they may be in private practice. The kind of work that health psychologists provide, they will do assessments and provide intervention services. So, for example, if you're a health psychologist and you're employed in a part of the hospital where people are being treated for diabetes, the health psychologist may come in and do some assessment work to determine the degree of competency of the person to manage their own diabetes care, while simultaneously providing education and intervention services to maximize the ability of the person to be successful in managing their disease and avoiding negative complications from that disease. They're going to work typically on a team. They're going to collaborate with other kinds of health professionals, physicians, nurses, and so on, to provide holistic health care. So they'll work with PAs, physicians, nurses, dietitians, social workers, etc., to help as a part of that holistic team providing good health care. They'll work directly with patients. Sometimes they will be experiencing chronic illnesses, especially illnesses where changes to so-called lifestyle, so things that like nutrition, exercise, other aspects of lifestyle that can have an impact on those chronic illnesses, on recovery from things like surgeries or injuries, managing other healthcare conditions, managing their mental health care conditions alongside their physical issues. So they may be involved there. Conducting assessments is a big part of what health psychologists do. They may do cognitive tests, behavioral assessments, psychological testing like personality assessments. They may collect demographic information and lifestyle information, do clinical interviews, and so on. All of that data collection is involved in developing tailored, personalized interventions for people. They may, and this is one of the reasons why health psychology is an area of specialization of clinical psychology. These are individuals who are trained clinicians. They have a license to provide psychotherapy services, so they can provide psychotherapy addressing patients' needs. They may, for example, be engaged in doing cognitive behavioral therapies to help modify negative thought patterns that can cause negative impacts on overall health, for example. Rehabilitation psychologists, again, you're talking about individuals whose training is typically as a clinician, and then they specialize in rehabilitation work. They're commonly found in rehabilitation centers or hospitals, working with people who are in recovery post-injury after having, for example, strokes or brain injuries or other kinds of neurological conditions. They will be involved in building and then putting into practice rehab programs for people. These may be, for example, pain management programs, anxiety programs, depression programs, and so on. Rehab psychologists may be working with people who have chronic conditions and age-related issues that interfere with independence. So, their job is going to be to address ways in which they can improve the emotional challenges, how people are approaching the emotional challenges that are connected to chronic illness, and support families who are in the caregiving role. Their job is to help people with disabilities to restore function, to build function so that they can maintain their employment for as long as possible. They may work with individuals to identify skills, but also to identify things that are getting in the way, things that are causing them problems with getting employment or maintaining employment, working with other kinds of professionals like social workers and caseworkers to advocate for inclusion. Some rehab psychologists have private practices where they offer individual or group therapy. They may work in private practice in pain management. So for people with chronic pain-related conditions, they may be working in that space to help people to manage the psychological components of their chronic pain. There are people who are rehab psychologists who work in cognitive rehabilitation programs. So for example, a person has a brain injury that affects their cognitive functioning. They may work with a rehabilitation psychologist to work on their psychological adaptation to those issues. Rehabilitation psychologists do tend to specialize. So what that means is they may practice in a very specific area of disease or illness or injury. So some rehabilitation psychologists are going to be very specifically connected to neurology and neurological conditions or brain injury and stroke. Other rehabilitation psychologists may specifically be associated with pain and pain management, etc. So the practice activities that rehabilitation psychologists engage in, they'll sound a lot like health psychologists. So there's a lot of assessment work that's being done. There's a lot of evaluation, determining what people's psychological needs are, what kind of emotional impacts they're having with their disabilities or illnesses or injuries. They may be delivering psychotherapy, which health psychologists also may do. The key differences are kind of hard to identify, but health psychologists are more likely to focus on changing behaviors, encouraging people to adopt habits and patterns of behaviors that make them more likely to successfully navigate their conditions. Rehabilitation psychologists are more likely to focus on rebuilding skills or rebuilding abilities so that people can function more independently. So it's more kind of a difference in terms of the focus. They may be working with the same people, in fact, or people with the same kinds of issues and medical challenges, but they're looking at it through a slightly different lens. Medical psychologists focus on the psychological aspects of disease or medical conditions or procedures. They tend to work in medical settings, hospitals, clinics. They may be more likely to work in cardiology, oncology, or pain management. And that's the case for health psychologists and rehab psychologists as well. Again, slightly different lens. They collaborate with medical teams to address the psychological components of the experience of illness. They may provide psychotherapy for patients who are distressed. That could be short-term, it could be longer-term. They may work with families who are in the caregiver role, who are also coping with the chronic condition of their loved ones. They may provide consultation services with physicians and healthcare professionals. Thinking of a concrete example of, let's say you have a patient who needs to have frequent scans, like MRI scans or CT scans, but they have panic attacks when they are put into a scanner. The medical psychologist may be pulled in to consult to find workarounds. So let's say that this person needs to have scans to track the progression of their cancer, but they have psychological reaction to the scanner. The medical psychologist may work with that patient to combat the panic that they experience, so teach them skills and techniques for managing their panic and their anxiety so that they can successfully navigate the scans. They may also work with the physicians and caregivers to say, is there an alternative? Like, can we use a different kind of scanner, like an open air as opposed to a closed one, and so on. The clinical work involves evaluating patients' mental health care needs, and the psychological impacts of their conditions. So another concrete example, let's say you have a person who has experienced a severe burn injury. A medical psychologist may be called in to work with that person as they navigate their treatment, but also their readjustment post-burn treatment. There are also elements of research and program development and evaluation that are connected to the whole area of health psychology. And these are typically research jobs, and they frequently involve either a doctoral degree or a master's degree. So health, rehab, and medical psychologists may not work in direct patient care. They instead may be working in research jobs where they're really pioneering new techniques or evaluating programs or providing prevention and intervention services for people in different settings. Health psychologists who are really in on building programs will be engaged in creating evidence-based programs and then testing them for efficacy. So, for example, they may be working on prevention of chronic disease, promotion of wellness, and trying to find out what are the programs that actually work for people. So they may, for instance, say, let's compare program A for diabetes prevention versus program B, which one is the most effective or successful. Rehabilitation psychologists may work to develop programs and then assess those programs that support individuals with disabilities and chronic conditions. And again, they may be engaged in building those programs out and then testing them for efficacy. Medical psychologists are going to be involved in building interventions. So, for instance, if their specialization is in cardiology, they may be working on building programs that work to rehabilitate people post cardiology event, like they've had a heart attack or a near heart attack, whatever. What kind of rehabilitation programs work? So they may develop a program and then assess to determine whether or not it's working well. The distinction between program development and evaluation is necessarily blurry. So to me as a researcher, if I'm doing applied research, I don't want to just build the program. I want to know whether the program needs to be tweaked, whether it needs to be ditched entirely. I don't want to just build a program, drop it on somebody's desk, and then not know whether it's doing good or whether it's actually doing harm or it's having no effect at all. So in practice, people who work in these spaces on research and program development, they're also typically involved in evaluation. Some individuals with interest in this area work in public health and policy as well. So this is a little more on the political side, but it's also much, much more on the community deployment side. Public health research tends to look at whole populations rather than individuals. So as a health psychologist or even a rehab psychologist or a medical psychologist working in public health, you're looking at the whole state or the whole community, the whole city, the whole country for that matter. So you're going to, if you're a public health researcher, you're going to look at health concerns at the community level. You're going to look at risk factors, social determinants of health, impacts of socioeconomic differences, and disparities. Looking at designing and evaluating policies and interventions, and determining what the best interventions are for specific problems. You may be engaged in looking at specific health-related policies and their implementation and determining what kind of impacts they're going to have, positive or negative. Advocating for policies based on best practices, translating research findings into practical applications on the ground may be a part of the work that these individuals do. These kinds of researchers may be in a lot of different kinds of settings. Historically, government agencies like Health and Human Services have been the most, at the federal level, state level, and local level, has been the most common. We are in a weird place right now, given the situation at the Department of Health and Human Services in 2025. That's a little murky at the moment, to say the least. But there still are other kinds of spaces where public policy researchers are working. They can work in nonprofits, they can work in non-governmental organizations, they can work in think tanks and private kinds of organizations doing research in this area. In the private sector, some organizations, and these are typically larger organizations, they may have people on their staff who work in roles that are health related. So for example, you may have someone who is the director of workplace wellness, and their job, and they may have various titles. So their job, sometimes coming out of HR, sometimes working out of the C-suite, they may be working in ways that are designed to improve employee health and well-being because it supports productivity, reduces turnover, and reduces health insurance costs for the organization. So their job is going to be to develop, implement, evaluate wellness programs. So like, to give you a concrete example, a corporation may have some goals where they really want their employees to exercise more, do their yearly preventive medical tasks, things like getting vaccinations, getting screenings, getting mammography, getting colonoscopies, and so on, because doing those things has practical benefits for the organization. So they may be engaged in building wellness programs, adding incentives for employees to engage in them, but they also may be providing a structure for people to get their mental and emotional needs met. So this individual may assess health needs. They may create programs specifically to target and improve health. They work with management to create incentive structures. They may also interface with healthcare providers and other departments of the organization so that they can meet organizational goals. Chief wellness officers are really at that administrative level. So they're going to have oversight over the various wellness activities of the organization. So workplace wellness directors will likely work underneath a chief wellness officer, and they will kind of interface with the CEOs and other people in the administrative team to achieve these wellness related goals that the organization has. Remember, their goal is to push these initiatives in their organization because they see it as having trickle-down positive impacts in terms of employee welfare, employee retention, reduction of turnover, increased productivity, reduced insurance costs. If you can prevent sort of chronic disease or illness, or identify diseases and illnesses early so that treatment is less expensive. All of those things are beneficial. In some cases, psychologists with interest in this space can work as consultants. So you may have PhD level consultants who are health psychologists who will be employed by organizations to work with their chief wellness officers, their workplace wellness directors, to build effective programs. They may be hired outright as people who work within the wellness offices of the organization. Some of the considerations, things to keep in mind about graduate education and training. For health psychology, there are a number of different pathways. On the one hand, you could go and earn a doctoral degree in clinical or counseling, and then choose your doctoral program based on its offerings of specializations in health psychology at the predoctoral or postdoctoral level. The second choice is to get a specialized doctoral degree. And the number of programs offering doctoral degrees in specifically health psychology has been growing in recent years, but there are fewer of these programs available. So generally speaking, it's more common pathway for people with interest in health psychology to get their clinical degree in a program that has a health psychology specialization. Graduate training in health psychology is fairly specialized, so it's important that you do your homework, investigate the programs that you're looking at, making sure that they have that health psychology specialization as a part of your training. For rehab and medical psychology, these are specialty areas of study. Typically, what's going to happen is people will get their doctoral degree in clinical or counseling, psychology, most often in clinical, and then get specialized training postdoctorally in their internships in rehab or medical areas. Some medical psychologists also will get a dual degree. So if we go back to chapter 5 in legal, in psychology and law, there are some people who get a law degree, a JD, and a PhD in psychology at the same time. It's a rough road to take, but it can be a very powerful position. So in some cases, you'll have dual degree programs where people are getting their clinical psychology degree at the same time as they're getting a medical degree. Master's level careers, a master's degree can give you entree into many of the same types of career paths that we've already discussed. So master's degrees in counseling can turn into jobs that take place in medical care settings. In most states, you can become certified or licensed at the master's level and engage in many of the same kind of therapeutic activities that health psychologists or rehabilitation psychologists or medical psychologists are doing, but you have to be under supervision. The master's degree emphasizing research methods and stats can be a really good base for moving into those public health types of policy and program development and research and assessment positions. There's also assistant type jobs, so occupational therapy and occupational therapy assistant jobs can be had at the below PhD or doctoral level. Occupational therapists get training at the master's level to deliver rehabilitative services to people with physical, developmental, or psychological conditions. And they specifically tend to work with people with movement and coordination issues. The goal for occupational therapists is to improve coordination, motor skills, balance, work on everyday tasks. Often students are like, why is it called occupational? Does that mean they're helping you get a job? Not really. It's tasks of daily living. Things like getting dressed, feeding yourself, writing, planning out motor behaviors, like how do I get from the bottom of the stairs to the top of the stairs? How do I get from the top of the stairs to the bottom of the stairs, etc. Occupational therapists are trained to do assessment, to create goal-directed plans, create interventions. The overarching goal is to help improve people's abilities to perform daily tasks, and often to work with the patient to define what their goals are, and then evaluating outcomes and modifying treatment programs as needed. Becoming an occupational therapist requires a master's degree in occupational therapy and passing a national board exam. And then after that, getting state licensure. OT assistants are going to help, very much like physical therapy assistants. You can have OT assistants who perform support activities like helping patients to do stretching exercises, to enact the plan. So like if there's practice that needs to be had in buttoning your sweater, the OT assistant may actually work with the client on that activity under the supervision and guidance of the occupational therapist. Becoming an OT assistant typically requires a 2-year certification program followed by a certification exam. Physical therapists and physical therapy assistants. Physical therapists have the training of physical therapists has moved in the direction of a doctoral level, at least in the description. So the degree that you get is a doctor of physical therapy. It's not as long as a traditional doctoral program, however. So physical therapists provide treatment and intervention for people who have experienced loss of physical function. They may be suffering from pain, loss of mobility, a variety of disabilities. It may be post-injury, post-illness. It may be also for people with chronic debilitating conditions or progressive diseases. PTs do examinations, diagnoses. They devise treatment plans that are designed to help people move better, reducing or managing pain, restoring function, and preventing or mitigating disability. They do hands-on therapy, prescribing exercises. They are trained to use a variety of treatment approaches and tools. They are also engaged in patient education. Now, any of you who are athletes who, let's say you've blown a knee, I see a lot of my students who've had ACL tears, and they go through physical therapy. It's a love-hate thing. You know, you want to get back to your sport, you need to do PT and you need to meet your PT goals. You may hate doing it. It may hurt to do it, but you're going to do it. That's what the physical therapist does. They may work with people who've had strokes, who have had knee replacements, hip replacements, you name it, any kind of injury, disease, illness that has affected physical functioning, the physical therapist may be involved. To become a PT, you have to earn a doctor of physical therapy degree. It's typically a 3-year degree, and then pass an exam and with the National Physical Therapy governing body, and then also a state licensure exam. Physical therapy assistants, just like OT assistants, they're kind of the hands-on the person who is going to enact the plan that the physical therapist has set up. Becoming a PT assistant is going to require 2 years of coursework in a PT assistant program and passing an exam. And that concludes my coverage of Chapter 6.